Total hip replacement is required or necessary in patients that have hip dysplasia or hip osteoarthritis. Hip dysplasia is the most common orthopedic disease that we see in dogs and cats. It leads to limping and pain in the back legs and can affect one or both back legs at the same time. Unfortunately, hip dysplasia is genetic, and so it's bred through numerous lines, and in certain breeds of dogs, it is so prevalent that it will never go away. So a lot of the purebred large breed animals are born with hip dysplasia. Some patients we can treat with medications to make them comfortable and improve their quality of life. However, certain patients have adverse effects to those medications, or they don't improve with medications, and those are the cases where we talk about total hip replacement. Total hip replacement is replacing the entire hip joint with size-fitted implants to provide a new joint to a patient after surgery. There are lots of other procedures that are out there to treat or manage dogs that have hip dysplasia, but total hip replacement is the only one that replaces the entire joint to give the dog as close to a normal joint as humanly possible. Immediately following hip replacement, we keep most animals hospitalized for 2 to 3 days. They receive an epidural before surgery, so they're really comfortable after the procedure. And then the day following the hip replacement, our staff and I start them on a gentle rehabilitation program to get them up, get them moving, and get them comfortable on the hip. In the long term, the owner's job is really to keep them exercise restricted at home, so not to allow them to do any crazy activity, no running or jumping or anything like that until they're cleared, and follow a very basic rehab plan at home to help build muscle mass and build range of motion back up in the hip.